Today, we're going to be discussing frown lines. Now, I know that my audience is mostly 20-something to 30-somethings, and most of you probably don't have heavy frown lines developing just yet, but this is a great analogy to how prevention is the best cure, and while going through this video, you should learn a thing or two about the best ways to avoid frown lines developing later on in life. So pay attention and let's dig in. What are frown lines? Well, they're fine lines and wrinkles that develop on your forehead, between your eyes, and near your nose with repeated facial use. So imagine them as creases that start to form as the muscles that start to form as you use that region more and more. So if you're frowning all the time, you can expect frown lines to develop. In the medical literature, these are typically known as glabella rhytids, where glabella refers to the glabella, which is the bottom, the base of your forehead, and rhytids is just the word for wrinkles. Frown lines are arguably more significant, maybe perhaps less than nasolabial lines or smile lines, because they have been shown to affect mental health and self-esteem when they do start to appear. They're one of those key characteristics that make a face appear aged, and most people want to avoid having those lines develop as long as they can. This so-called alteration in your self-perception and even the perception of others of you can take a toll on a person's mental health, making frown lines a significant psychological burden, which is why frown lines are one of the big three concerns that people have when going to a dermatologist to reverse aging signs. The major concern with frown lines are that they give the face a constantly annoyed or angry appearance, which can limit one's social and personal connections. But rather than seeking correction later on through invasive treatments, it's better that you're aware of what the main causes are, and as we're going to go through them, aging is the biggest one. As somebody ages, the skin loses elasticity and the collagen content, which is obviously important for the structural integrity of the skin. So then once its structural integrity is lost, the skin becomes a lot more flaccid and it doesn't really go back to its elastic shape. Think of it like stretching a rubber band way too far. It doesn't return to its original shape after a certain point. Now, aging is directly tied to sun exposure, where UV rays have the same effect on the skin as the aging process, which is why skin damage from sun exposure is referred to as photodamage. Suppose you are Count Dracula and you lived your entire life in his castle, you never once saw the sun, then natural aging would have a very slow effect in its decreasing ability to replenish collagen. But sun exposure is the bigger culprit of why collagen is lost off your skin in the first place. I make a very personal note of this myself, where I always wear sunscreen whenever I'm going out, and as most dermatologists can recommend, sunscreen is the biggest prevention for skin damage. On the channel, we've spoken about the dangers of sun exposure ad nauseum, so we're not going to talk about it here. However, if you do want some advice on choosing a good sunscreen, we have a few article write-ups on the Coos website, but my piece of advice would be choose something that you can wear consistently without it really feeling like sunscreen. If the sunscreen is very heavy and it feels like some type of heavy beach sunscreen, you're not going to be as inclined to wear it every day as part of your normal skincare routine. So you cleanse your face and then perhaps put on a moisturizer and then maybe later on some type of sunscreen if you're going out. Personally, this isn't a sponsored segment or anything. I would just recommend La Roche Anti-Helios SPF 50. It's very light, it's a bit more expensive, but that lightness helps me tolerate the sunscreen and it just makes it so much easier for me to adhere to my routine. From Flement et al.'s paper, sun exposure was responsible for over 80% of the visible aging signs in a Caucasian sample over a 10-year period. Now, mind you that in a previous video, we did mention that skin color is an important factor to consider in sun exposure, where those with darker skin color have higher melanin, and so they're supposedly more tolerant of sun exposure for a longer term period. However, and this is a big however, dark skin only accounts for a natural SPF 15. So it doesn't really protect you from sun exposure at all. SPF 15 is relatively quite weak, especially if you're living in a country with high sun exposure and or a ozone hole above it. So in short, everyone should be wearing sunscreen, and if I had to recommend one product that you should really have on your list of routine products, it should be sunscreen, and a good quality one at that. Moving on, let's talk about smoking. Nicotine and tobacco in your cigarettes result in the formation of fine lines and wrinkles by constricting the blood vessels of the skin. This decreases the oxygen supply that actually goes to these regions and then makes them more susceptible to damage from environmental toxins and extrinsic factors like sun exposure. So it's a 1-2 punch. The sun exposure damages your skin and the smoking inhibits it from repairing itself correctly. Found this particular piece of research paper very interesting, from Facial Wrinkling in Men and Women by Smoking Status by Ernster et al. They basically suggest that if a link between smoking status and skin aging is found, then this would be a far more effective way of convincing young people not to smoke compared to advertising the actual very serious long-term health risks that come with smoking. And if that doesn't say something about our society, then honestly, I don't know what does. However, the results aren't as clear-cut that smoking is the direct cause of wrinkling. Those who have never smoked in the male group have almost the same amount of wrinkling as heavy chain smokers in the 60 to 69 group, but this is likely an outlier, as for all other groups, heavy smokers have the greatest severity of wrinkling. With the female group, this correlation is much more linear and easier to see. If I had to guess what may have caused this outlier, men typically get more sun exposure, with a greater number of men participating in manual labor work than, say, women, and so as sun exposure is a real culprit of skin degradation, smoking just slows down the repair, mind you. The researchers did not control for even levels of sun exposure in each group. You can't really fault the researchers either, because it'd be very hard to find two men of the same age group who have smoked different amounts throughout their lives, but have somehow had the same amount of sun exposure, and almost every other skin factor has been controlled in some way. The next potential cause of frown lines forming is stress. When we're stressed, we release a hormone called cortisol, and while this is a normal hormone for regular human functioning, chronic exposure, in other words being stressed all the time, is very detrimental to skin health. From Cortisol Control and Beauty by Dr. Sean Talbot, cortisol is reported to have a destructive effect on collagen, and if you remember, collagen is one of the building blocks of our skin, so when it disappears, our skin loses its structural integrity. While Dr. Talbot has written a plethora of knowledge in his book, let's keep it straightforward to the point, with Dryland et al. Study finding an increase in perceived age correlated with fasted cortisol levels. I do understand that endocrinology is incredibly complex, and even the authors of this study acknowledge that disentangling the effects of different hormones is very difficult, but it should be fairly intuitive that chronic stress is just bad for your general health overall. Constantly furrowing your eyes in anger is a surefire way to embed frown lines into your face, especially by repeating the same facial expressions over and over again. This ties into our next potential factor, that facial expressions and repeated muscle use are one of the culprits of actually developing these frown lines. Squinting and frowning and other expressions of anger and frustration require the use of the glabellar complex muscles. Just like we call a collection of buildings a complex, we can also call a collection of muscles that work together a complex. From Hilbrand et al.'s 2010 study, which was taken over 8 years, they found a predictive effect between those who persistently use the same facial expressions and those forming into defined wrinkles later on in their life. They also suggest that having more alkaline skin with a drier stratum corneum, in other words, just having dry skin with a lighter complexion and being middle-aged or menopausal, does speed up the process of these wrinkles forming as a result of facial expressions. Although all of these factors can work together to result in the development of frown lines, repeated use of the glabellar complex, so just frowning a lot and being angry and furrowing your eyes, and sun exposure dominate as the major causes over the other risk factors. This is quite significant because frown lines can appear in several patterns and can be of different types and shapes depending on which facial muscle is under the most strain when forming your facial expressions, like if you're always frowning your eyes or you're squinting them a lot. These patterns are typically horizontal, vertical, oblique, and generally appear in one of the following sub-patterns. So there's a V-shaped frown line, which is the most common type, and this affects approximately 37% of affected individuals. These frown lines can pull the inner edge of the eyebrow inwards, resulting in a frown that forms a V, and it's typically what's known as the angry frown line because it makes you look permanently grumpy. Then there's the U-shaped frown line, and this pattern is the second most common, which involves the elevation of the outer eyebrow along with the features of a V-shaped frown line. Even less common is the converging arrow-shaped frown line, where this pattern is seen when only the inside of the brow is affected and come closer to each other with facial expressions, typically more of a squint frown line. Then there's the omega frown line, which this pattern includes lowering of the outside of the eyebrows and elevation of the inner side of the eyebrows. So these are facial expressions that require more deliberate action. It's not something you do as a knee-jerk reaction. And lastly, there's the inverted omega frown line, and you may be wondering what the hell is an inverted omega frown line? This pattern is quite rarely seen and is commonly associated with a flattened nasal shape. The best way I can explain it is through this meme. I knew I saw it somewhere before. I was like, where did I see this shape? By now you're probably wondering, how can I tell if I have frown lines? Well, it's pretty simple. If your face looks like it's angry, even when it's not, then you probably have some sort of frown line which is giving that impression, but the diagnosis process is quite straightforward. A simple examination of the frown lines by a doctor is more than enough for a diagnosis and a treatment plan to be made from. When performing the physical examination, a doctor will typically pay special attention to facial anatomy and anatomy of the facial expressions, as in which muscle is being contracted the most with each expression. Some people do their expressions differently. If you're angry, some people do more of a squint and others do a full eyebrow furrow. Some may even raise their eyebrows, so it depends on each person's anatomy. You wouldn't want to Botox the wrong muscle and then just have droopy eyebrows, or add filler to the wrong area and be unable to move your eyebrows altogether. Generally, frown lines are treated with topical agents or injectables, and this would be done mostly at an aesthetic clinic with one doctor and one esthetician doing the administering of the filler. And depending on the depth of the facial lines and patient preference, there can be other non-invasive methods like laser resurfacing. There are a lot of homemade remedies in the form of avocado mask, coconut oil massages, and so on that can be done in the early phases of frown line development, but like I said, the best cure is prevention, and so investing that money from avocado masks to a better quality sunscreen is going to do you a lot more good in the long run, and there's also no scientific backing on any of these home remedies actually working. There are some topical agents that can actually work to treat frown lines and do have some moderate level of efficacy, although nothing quite as efficacious as using fillers and injectables. One of the more common ingredients is hyaluronic acid, which is a natural component of the skin, and it decreases as time passes and with age, so replenishing it is helpful, but how much of that actually goes into the skin from a topical agent like a cream is very dubious. Topical use of this agent does help rejuvenate the skin, as hyaluronic acid is responsible for the stimulation of collagen, but the effect isn't as great as you may expect, but it is better than nothing. From Nobile et al. Study on hyaluronic efficacy, they found wrinkle volume decreases of 11 to 26% and wrinkle depth decreases of 8 to 21%, so there is something there, but the variances are great and not the same for everyone. Jegasorti's study saw hyaluronic acid with smaller molecules being more effective with reported rates of up to 40%, so it could just be that skincare technology is a bit behind, but it is catching up now with modern advances. The next frown line fighting ingredient that we should be talking about are retinols. They're a derivative of vitamin A, and if you've used any sort of high-powered anti-acne cream, then chances are there's some type of retinol. I like to think of retinols as the scorched earth solution, where you just slough off the bad skin from the outer layers of the epidermis and encourage regrowth for the inner layers to produce a new protective layer. Topical retinols have been associated with increased collagen content, and it does so by promoting collagen synthesis at a genetic level. Retinol upregulates the genes responsible for collagen production, which does reduce fine lines and facial wrinkles quite significantly. Unlike tretinoin, which is used in heavy-duty acne medication, and we did talk all about this in this video here, retinols have a lower risk of skin redness and irritation, so they can do similar things but with a lower risk of adverse reactions, which makes them perfect for over-the-counter cosmetics. However, obviously there's going to be a trade-off, and retinols are 20 times less potent than tretinoin, which is after all reserved for heavy-duty acne medication and for those with very severe acne, so it's not crazy to expect that a prescription drug will obviously outperform a over-the-counter cosmetic. From Fisher et al. 1996, retinol was found to inhibit UV intake, in other words reducing photo damage, while also stimulating collagen synthesis, so there is a lot of promising research that retinol does actually work. But how much of that goes to wrinkle reduction? We really don't have a lot of research in that field. The last ingredient for this list is niacinamide. Now, niacinamide, or vitamin B3, also has anti-aging properties along with antipruritic and anti-inflammatory ones too. This ingredient is especially helpful in treating frown lines that have developed as a result of UV exposure and subsequent photo damage, as it helps to undo some of the work that's been done by that kind of damage, namely hyperpigmentation and, to a lesser degree, some of the wrinkles that may form. Niacinamide has been shown to improve fine lines, but nothing substantial in the way of heavy wrinkles like you would expect from frown lines. For well-developed frown lines or glabellar-rhytids, it's much better to go with an injectable route, as that will provide more visual and, more importantly, more immediate results, which will likely have a more meaningful impact on self-esteem. Some of the injectable treatments of frown lines include the use of botulinum toxin type A, or Botox for short, and dermal fillers containing hyaluronic acid, collagen, hydroxylapatite, and poly-L-lactic acid. but Botox injections generally smoothen the skin and typically have some of the best results by preventing the overactive facial muscles from contracting and straining over the overlying skin. So you can imagine you're just pulling that skin taut, which will hide the crease that's formed in the shape of that glabellar furrow. Dermal fillers, on the other hand, reduce frown lines by injecting components that would promote wound healing and repair the skin from the inside. If you can imagine, you're just filling that crease in, that furrow, with actual filler material to flatten the region out. So there's two approaches to smoothing out what many consider an unsightly wrinkle. It is important to note that if you're visiting a clinician or an esthetician or some sort of aesthetic medical doctor, to ask how long your fillers or your Botox injections will last for, as dermal fillers typically only last for 6 months, and so you have to do a cost to benefit analysis to see if it's really the best option for you. If you're wondering if you even have these types of wrinkles, or what type it is, what shape it is, what pattern it is, what treatment options you should be pursuing, or you just want a second opinion, then I would suggest that you order a Koov's aesthetics report where the assessment is done by a doctor or a dentist. And on our team we have an esthetician who is a professional and has been doing fillers for a long time in her own clinic, so you can review our personnel over at the website and you can trust that you're going to be in good hands and you're going to get actual quality facial aesthetics feedback. After you purchase your report and you get it back, you can ask as many questions as you like, because I've always emphasized the importance of customer service, and that's a key feature of all of the reports. Any type of report we do, we have done, or we will do in the future, that gives you a lot more value for your money at an incredibly reasonable price. Also, if you want to learn more about glabellar or frown lines, then I suggest you check out our medical writer on our website on the whole etiology of this wrinkle, from the causes, the prevention, the treatment options, everything mentioned in this video, but with far more detail and research. Just one last thing, I recommend you check out our TikTok account and follow us there, and also you can post to the r/Koov Studio subreddit, where I do read every comment and I love replying back to the stuff that you guys put out. It's a lot easier for me to reach out to my audience than it is for me on YouTube, where every comment I make gets buried under a wash of 1,000 more.